Up next, we have Father John Schieffler, and he's a clinical assistant professor at Sacred Heart University, and I'm sure so much more, but this is the only...
To do the thing.
Okay.
Although, I'm not sure if putting me on after the life of a saint is going to... I'm not sure I can top
short
that.
end of the, so you drew the short stick, but that's okay. Welcome, Father.
Thank you. Glory to Jesus Christ. So I'm, as she mentioned, I'm Hieromonk John Schieffler. I'm a priest at St. Nicholas Russian Orthodox Cathedral in Manhattan, the representation church from the Moscow Patriarchate in the United States. I'm also a clinical assistant professor of health administration and informatics at Sacred Heart and of policy and management at NYU's Global College of Public Health, which is why I'm pursuing the work that I'm working on now. So the title is Compassionate Administration, Utilizing Pastoral Theory to Guide Healthcare Administrative Policy. I teach students, MHA and MPH students, how to become healthcare administrators. What I've noticed across the programs of healthcare administration is that at no point, unlike most of the other fields in the clinical aspects, do we teach anything about spiritual guidance, anything that has to do with holistic anything. And because of the work I do, I'm also biased in that I believe that you cannot have good healthcare without good healthcare administration. A clinician cannot practice unless they have a place to practice. That place has to have lights on, it has to have clinical equipment, it has to be licensed. You have to be paid for the clinical work you do. It is administration that allows that to happen. So as compassionate as we might want to be at the patient's side, if the structure doesn't support it, it's almost prohibitive. So, no, I'm not going to read the whole thing, but healthcare administration plays a crucial role in maintaining the efficiency and effectiveness of healthcare organizations. The balance between access, cost, and quality of care often hyper-focuses administration towards the business end of the healthcare firm. However, amidst the challenges and demands of the healthcare industry, the spiritual and emotional dimension of patient care and employee well-being are often overlooked. Integrating, this is my theory, pastoral theory into healthcare administration offers a unique opportunity to bridge this gap. By adopting principles of pastoral care, administrators can create an environment that nurtures the physical, emotional, and spiritual needs of patients and staff alike. So what I'm proposing is not pastoral care at the patient bedside. That's already taking place. But in the C-suite, at the administrative side, because it's often where we healthcare firms have problems. Compassionate administration is an approach to administrative policy that recognizes the importance of empathy, understanding, and support in creating a positive and inclusive working environment. By utilizing pastoral theory as a guide, administrators can effectively address the emotional needs of individuals within the organization while also promoting productivity and well-being. So to frame this, and this is somewhat of a work in progress, I'm looking at pastoral theory around two sort of paradigms. One, pastoral care, defined as providing spiritual, emotional, and relational support to individuals and families, with the core principles of compassion, empathy, active listening, and unconditional positive regard, right? Basic definition. Pastoral theory, which comes from this concept of pastoral care, and there are some differences depending upon who you read, rotates around four dimensions: a spiritual assessment, recognizing and addressing patients' and staff's spiritual needs; an emotional support something, providing a safe space, whatever that means in the institution, for expressing and processing emotions; relationship building, fostering trust and connection between patient, staff, and administrators; and ethical decision-making, integrating ethical frameworks within healthcare administration, supported by my other bias, Christian ethics, right? But there might be other ways to do it. Pastoral counseling is a unique form of therapy that combines psychological knowledge and spiritual guidance to help individuals overcome emotional and spiritual challenges. It is rooted in the belief that faith and spirituality can play a significant role in promoting healing and personal growth. I mean, that's sort of what this whole conference is about. So the term pastoral counseling derives, of course, from the word pastor, which refers to a spiritual leader or minister. Pastoral counselors are typically trained in both theology and psychology, allowing them to address the spiritual, emotional, and psychological needs of their clients. They provide a safe space and supportive space for individuals to explore their beliefs, values, and emotions while also integrating, again, my biased biblical teaching in what they're doing. So one key principle of counseling is the belief in the inherent worth and dignity of every individual. We teach this to clinicians. We don't teach it to administrators because it is not their main focus. Their main focus is to keep the lights on, to keep patients in and out, to keep the insurance billed. But what if we change that idea on the educational level? What if our administrators had a deeper concept of what it means to be pastorally sound to an institution? We ask our priests to do it, allegedly. We're supposed to be pastors of our congregations. Well, what about administrators? They're the ones that are actually running the place. Pastoral counseling acknowledges the interconnectedness of mind, body, and spirit. It recognizes the emotional and psychological distress can have a profound effect on an individual's spiritual well-being and vice versa. By integrating spirituality into the therapeutic process, pastoral counselors help individuals find meaning, purpose, and hope in their lives, even in the face of adversity. One of the primary goals of pastoral counseling is to assist individuals in finding resolution and healing in their emotional and spiritual struggles. We do it with the patients. Why not with the organization? Pastoral counselors provide guidance and support through various therapeutic techniques such as listening, empathy, and reflection. It's particularly beneficial for individuals who seek therapy that aligns with their religious or spiritual beliefs. Now, this might be difficult when you're head of a hospital with 14,000 beds, but not impossible. They can help couples, for instance, navigate relationship challenges, assist families in resolving conflicts, and offer guidance in communities in times of crisis or grief. In communities, our practices are in communities. We are part of neighborhoods, oftentimes crucial parts of populations where health inequities and health disparities are a real thing. What if the institution took the pastoral lead and not just the clinician? The clinician can only go so far. A clinician sees a patient. An administrator might be in charge of how many thousands of lives that work within that organization. They too, I would argue, have a mandate from Christ to do the right thing. But we have to help them to do that. Administratively, it recognizes that people are not solely defined by their roles or responsibilities, but also by their emotional experience and well-being. This broadens the administrator's role beyond institution-generated outcomes to include holistic approach to staff management, for instance. Applying this approach to administrative policy involves creating a framework that considers the emotional needs of employees and encourages a compassionate approach to leadership, such as staffing, unit coverage, benefit packages, time off, and other work issues. Our clinicians operate in an employment situation, and like any employee, they have concerns that sometimes go beyond the work that they're doing. If the administrator was more in tune to that, at least this is one of my theories, that would make for a less toxic work environment. Have you ever worked in a toxic place? It's not fun. And oftentimes, in many studies, burnout of clinicians has less to do with their patient load or client load as it does with a toxic environment. Their coworkers, it's who they don't like. It's not their patients. So keep that in mind. Recognizing, of course, that the spiritual side of healthcare outcomes is present while not always well understood, its application has both patient and practitioner impact. Miller, for instance, did a study in 2023 and colleagues with nurses in palliative care, and it demonstrated that, quote, the complex and multidimensional experience of the patients that nurses serve requires a sensitive approach that goes beyond clinical protocols. This is supported, for instance, by core competency modeling that has risen, such as recognizing spirituality as an integral component of human experience of illness, healing and health, collaborating closely with spiritual care professionals, performing spiritual histories in a patient-centered, confidential, and respectful manner, etc. So there are spiritual competencies, believe it or not, that are often built into, for instance, board competencies that nurses have to take. Some of the clinical programs have a spiritual component, or at least a holistic component, but administration does not. So to ask a clinician to do this and not have the system do it is counterproductive. That's my main argument. Also, they point out that with nurses, unique sense of spirituality can serve as a powerful resource for resilience. This idea is supported by the number of chaplains employed by healthcare organizations that are available for both patients and staff alike. I'm talking about large healthcare systems, obviously. Such as a need would not be financially viable if there were not patient demand to support their presence and therapeutic influence. In my city in New York, recently the nurses went on strike at Mount Sinai. Mount Sinai is a huge health system. It's now part of Northwell, which now owns, I think, all of Long Island, or manages all of Long Island. But their demands were not so much their workload, but the environment that workload created. So, of course, they were asking for more money because they felt they deserved more money, but oftentimes their complaint had to do more with environment than it actually had to do with patient load. We saw this during COVID. Many nurses are no longer nurses because of nursing burnout. Well, who created that burnout? You could argue patient demand, but it was the administration that was scheduling the nurses to begin with. Had they been pastorally trained, or at least familiar with some of the concepts that pastoral theory involves, my argument, that might not have happened, or at least it might not have happened in such an overt way. We talk about things like holistic well-being, which involves addressing patients' spiritual needs that we know, clinically shown, improves overall patient satisfaction. Patient satisfaction, the happier the patient is, the more likely they are to heal. We've seen some talks during this weekend about this. Of course, integrating pastoral care principles enhances that patient-centered care that we like to put on our mission and value statements in our hospitals, but do we actually do it? Perhaps as hospital systems and as clinics, we tend to put it out there as a mission that we want to use holistic healing in our patient care, but we just slough it off to the what's going on at the bedside. It is beyond that. It is beyond that. This includes promoting open communication and active listening and the time for care to providers to actually do that. This has to do with scheduling. It's that practical. Work done by Ryder and colleagues showed that the negative organizational culture was a major factor, for instance, for physician burnout. We don't hear a lot about physician burnout. We tend to focus more on the nursing and therapeutic areas, but doctors burn out too. And oftentimes, it is not their patient load that's causing it. It's the places they work. More physicians leave places because they're miserable from the place, not from the work that they're doing. And there's research that supports this. So that's an administration issue. That's not a patient care issue. It's not a patient load issue. At least that's my theory. By active listening and showing empathy, administrators can better understand the needs of their employees and find ways to provide support. This might assist in any gaps that might be addressed, but that might be assumed with policy initiatives that might seem as punitive. A common complaint of clinical staff is that administration makes a policy, expects everyone to do it, but no one asked them. Simple things like how people are scheduled. Scheduling is a big one. Not just staffing, but how that staff is managed and utilized. Pulling nurses, for instance, who are trained in pediatrics to med-surg floors is a common complaint. They're in pediatrics because they don't like to work with adults, and God bless them, they shouldn't be. But it's a common experience in the hospital system. This happens sometimes with physicians too. The role that pastoral care can play in the easing of physical suffering is broad and very case-specific, yet the positive response that this care provides is generally understood, if not necessarily well studied, and some research I did with some colleagues a few years ago showed that as well. So in terms of staff, we're talking about staff satisfaction and organizational culture. Recognizing and addressing staff's emotional and spiritual needs improves job satisfaction. If people feel they're being heard, they tend to do better. If people like where they're going, they tend to work better. There's a lot of research about that. So my idea is that in compassionate leadership, administrators should be trained in pastoral theory to provide empathetic leadership. Empathetic leadership that will positively impact employee morale and organizational culture, aside from the business demands of that firm. And I think that's where the rub is. When my students go on to take administrative positions, their first task is to make the organization viable. Sometimes in doing that, they lose their souls. Amen? And I've seen it. I've seen it. You can see that, and it's not their fault. And it's not, it might be the devil, but it's not their fault, right? It's because the demands of healthcare currently, especially in this country, is complicated. We have a fragmented system. It's difficult to navigate. If you lose your way trying to navigate in a way that's already arguably somewhat broken, then you're bound to be slightly broken yourself. But by pulling them into some sort of pastoral ideation, thinking along pastoral terms, One thing that I suggest as part of this work is making sure that if your organization has a chaplain, include them in the decision making, especially if it's a hospital. They are at the bedside of the dying, but that's not all they do. They're also counseling families who are in grief. Families that if you have a loved one, or you've been in this situation yourself, if you have a loved one having surgery, how traumatic that is. As a member of the family, you're not thinking about the hospital bill. You're not worrying about how the bills are going to be paid for that institution or whether or not the physician who's performing the surgery is well paid. But think how powerful it would be if administration was and understood that the trauma that you're going through administration can be helped too. Perhaps the system in your institution is difficult for patients to navigate. This is part of health inequity. It's not about just getting into a healthcare system, navigating once you're in there. This is one of the issues we have in this country, and other countries such as Canada and the United Kingdom suffer from the same thing. They have systems where it's very easy to find a general practitioner, good luck if you need surgery. That's a stressor. Besides the health implication, that's a stressor that the system can fix if they think slightly more pastorally. So, to be sensitive to time, how do you do this? How do you make this happen? Well, my theory, my approach is, one, we have to include some sort of pastoral-ish kind of thinking in the education of administrators, from the master's level on up, because they're the leaders of healthcare in the future. And if they're not thinking about Christ, fine. At least think about what you're doing and how that's impacting the spiritual life of someone else. I didn't mean fine, like that was good. What I meant, well, you know what I meant. Because obviously in many secular institutions, we have to be careful, right? Although, as the example that we were just seeing, how many saints arose during the communist time? The hundreds that we know of, the hundreds of thousands of saints, many of them worked in healthcare, whose names we have lost because we never knew them. So it can be done. One, you want to assess the need, getting administrators, especially C-suite level administrators, on board with this idea that pastoral counseling, or at least the chaplain, needs to be involved in the decision-making of that institution. Second, you want to develop a pastoral counseling program that you can teach to administrators in that institution, something that works for them. Education, I find, is a lot like recycling. People will do it if it's convenient, if it works for them. You have to make it work for their schedules, but it can be done. Also, taking away some of the stigma that might exist. Just because you're in a secular institution does not mean that you can't talk about God. You just have to do it sensitive to the culture that's around you. You want to establish policies and guidelines that help to guide that education and make sure that it's actually being done. Oftentimes, institutions will go through strategic planning, and they'll take that plan, spend months and months working on it, and then stick it on a shelf. If pastoral theory is integrated into that plan, it has to be actuated. It has to be done, not just on a piece of paper. Obviously, this involves training and education. Training and education opportunities for managers and supervisors to understand the benefits and potential challenges of incorporating pastoral counseling in the workplace. This will equip them with the knowledge and skills to support and communicate effectively with employees seeking guidance. Training should also include information on cultural sensitivity, religious diversity, and the importance of maintaining a non-discriminatory environment. One way to do this quite financially feasible is incorporating it as part of the wellness programs that most institutions, large institutions, have. Through the insurance carriers that institutions insure their employees, most have a wellness aspect to that coverage that you already get. So let's include a little chaplaincy conversations as part of that wellness package, certainly for those employees who want it, but also as a potential training ground for those who might not know the benefits of such counseling. We want to obviously promote awareness throughout the institution that this is an institution that cares, not just for your physical well-being, fine, but for your emotional and spiritual as well. There's no sin, shall we say, in using the word spiritual in a secular context. People do it all the time. Finally, of course, some sort of monitoring and evaluation that allows you to assess whether or not what you've done has been effective. If it's helped, if the CEOs and the CFOs and the clinical managers understand the importance of the spiritual, then their employees should see that. It should be evident in their behavior, in how they speak to one another, and how they speak to those who work for them and those who work above them. So in conclusion, integrating pastoral theory in healthcare administration is a powerful approach to address the spiritual and emotional needs of patients and staff. By adopting principles of pastoral care, administrators can create a more compassionate and patient-centered healthcare environment, leading to improved patient care outcomes and employee well-being. To fully realize the potential benefit, training healthcare administrators in pastoral theory is essential, assuring that they possess the necessary skills to provide holistic care and foster a supportive organizational culture. Ultimately, compassionate administration recognizes that the emotional and psychological needs of individuals is integral to their overall success and fulfillment within an organization. By utilizing this theory as a guide for administrative policy, administrators can create a supportive and nurturing environment that brings out the best in each individual while fostering a sense of community and belonging. Amen. Thank you very much.
There's still time if you have questions for Father John.
I've stunned you into silence. Yeah, yes.
Very good. Thank you very much, Father. It's like one of those things where, why wasn't this thought of at the get-go? It's so obvious. But I want to throw another layer of chaos into this, especially since COVID. A lot of administration is being done remotely. And what's the pastoral implications of how pastoral care could help that situation, engage in that situation? I don't even know what words to use to describe how much chaos is created, but I'd love to hear your thoughts on that.
So the remote world that we live in and that healthcare still very much lives in, I think requires a slightly more, as the elder who we just heard promoted, an inner silence. And that's where it starts. So in the idea of pastoral theory, we teach the administrators that, fine, you want to do things on Zoom? Maybe pray before you do it. Maybe spend a little bit of time before the meeting, because people don't. I mean, I don't, and I am a priest. So it requires a mindset that allows you to refocus your emphasis, not on the task at hand, but on how the task at hand can support the people that you, in fact, are in charge of. That would be my idea. It requires a deeper sense of inner reflectiveness. Father.
Two things. One is, do you have a short paper of this that you could share with us?
Not quite yet. I'm still working. Yeah, I'm working on it.
Second thing is, it's very new, very fresh guy. I've never heard this before. And I'm wondering if you have an actual example of maybe one of your students or something that went in and were able to significantly change the culture in this way, and what a couple of the things maybe were that arose from it.
Not yet, because I haven't yet integrated it into my own work, although I'm working on it. Fortunately, so I have to operate as an educator. I have to operate within the accrediting body's guidelines of what I can teach and what I can't. However, what I have found is, so to answer your question, no student has come back to me yet, mainly because I don't know that I've done it. But there are ways, however, of integrating a spiritual approach, and through that, possibly opening up to this idea of a pastoral approach, separate from the secularized sort of spiritual mindfulness. Nothing wrong with mindfulness, but obviously I think it's limited.
Yeah, I think what strikes me as important about what you're doing is that you're raising the pastoral